Female Genital Schistosomiasis (FGS) is a gynecological disease caused by untreated infection. This neglected tropical disease is widespread in Africa in rural and urban areas. 40 to 56 million women and girls are estimated to be infected with FGS globally. FGS increases the risk of HIV infection, infertility, mental health, as well as misdiagnosis as sexually transmitted infections (STI). Female genital schistosomiasis is transmitted through contact with infected water bodies. Some of the symptoms include vaginal discharge, blood in urine, genital itching or burning sensation, and pelvic pain. The training on female genital schistosomiasis is part of the FGS Accelerating Skill Together Fast package project. More than 25 healthcare professionals were trained on the prevention, diagnosis and treatment of FGS. The director of the Institute of Health Research of the University of Health and Allied Sciences, Professor Margaret Japon, said FGS should be integrated as part of advocacy, awareness raising and health promotion activities.
The good thing about what we are doing here is that we have a core group of people who have gone through different levels of training, and now we are training them to be trainers. So hopefully as they go about their outreach, as they go about their home visits, they'll be able to talk about it as a problem, which is a consequence of schistosomiasis.
Let's share the knowledge we acquire with others, because the more of us know about FGS, the better it will be for all of us.
A senior research fellow at the WHO Collaborating Center for Knowledge Translation, Technology Assessment for Health Equity, and an assistant professor at the University of Ottawa, Dr. Alison Krentel, called for a collaborative community efforts by the local governments and administration in the fight against FGS.
If you're in the community, you're a community leader, you're a pastor or an imam, you can create awareness within your community about the risks of schistosomiasis, the risks of contact with freshwater bodies and the risk for infection, and also creating awareness around the availability of treatment.
Some participants shared views on the training.
It's going to build our capacity and it's going to help us to enable us to render better care to people with this condition.
Civil society organizations coming together, forming a consortium, and then having funding organizations and individuals who can actually support us to do a lot more research into some of these neglected tropical diseases so we can bring more light to it to the public.
The SME training is the final stage in a series of trainings conducted as part of the FAST package. There was identification of core competencies, online training, face-to-face training, and an impact accelerator. The Female Genital Schistosomiasis training program is scheduled to take place in Madagascar sometime this year.